guys. So we're going to start the session. Good evening to you, wherever you guys are. I'm so happy that we are being able to do this. And so to begin with, like the title says, in this session, we are going to be discussing the 15 common mistakes that everybody does and follows in the Plab-2 examination and how to avoid them so that it's very easy for you to ace the exam. I mean, I'll not be talking about the theoretical part or the knowledge part. These are very simple, small steps that you can follow so that you can have a very convenient day and something that's very comfortable for you as well as the people who are going to take your exam. So this is just some tips on how you can deal with the Plab-2 examination on that particular day and just a few days before the exam. The session is going to be for almost like an hour. To the end of the session, we will be doing a practice station as well on, it will be an ethical station on non-accidental injury in pediatrics. So yeah, I hope I'll find a volunteer for that as well. So let's begin. So there'll be 15 mistakes that I'll be talking here. The first one that I want to discuss about is about how you follow a script. So it's commonly said that it is important that we have a script, since most of us are coming from countries which is where we haven't studied in the UK, and that's why we're giving the Plab exam. So the countries where we study, the way we are made to talk to the patient, approach the patient, it's all very different. So it is important that you have a script that you follow, so that you have an idea about how people in the UK expect their doctors to behave. So it is needed, it is necessary to have a script, but then do not by heart the script. Do not be something like you have to stick to the script so much that if you lose a line from the script, you panic and you freak out. Don't go that way. Like, give your script reading maybe once or twice so that you have an idea of what you should be knowing and doing in each station. But more than that, don't try to mug up lines from the script. That's what I'm trying to say with this slide. Like, you need to understand the concepts. You need to understand what they expect from each station. Like if it is an ethical station, what is the whole point, or what are they expecting from us? To know what exactly that is, you need to have a script, but then you should not stick to the script line by line. So don't do that. It's just going to act as a guidance for you, like to where you have to go, but it is not a blueprint or a plan on how exactly you should be acting word by word. Like altogether, the whole clinical, it's a clinical exam. So the whole setting should be something where it's like a normal day at work where you're going to talk to your patient, take history, deal with their concerns, and like build a good rapport with them. Like just take it like a conversation that comes out naturally instead of following a script, because the simulators there, they do not have a script. So if you try to stick too much to the script, it's going to be difficult to stay in line with them. So my first tip for the day is that following a script should be avoided. Like following it so hard that you do not use your logical thinking. So that's the first step. Moving on to the next one, going into panic mode. This happens, I mean, because this exam is quite vague, to be frank. Like how much ever experienced we are, we may find it to be difficult on how to deal with the exam. And most of the times it's our nerves that take over our brain. Like we end up being so nervous that we forget things that we are actually aware of as well. I mean, I know it's easy for me to say since I've already cleared my exam, to say that don't go into panic mode. Like on my exam day, even I was panicking. So I know it makes no sense, but I want you guys to understand that these are charts which I found in the BMA. Like it shows that the UK has a serious shortage of doctors. They need doctors. And with the new PM, he announced yesterday also in his press meet that he's going to hire a lot of doctors, and he's going to include people from all the countries to improve NHS. So that is one of their main agendas, and they are going to need more doctors. So you have to understand that they also need you to get the GMC registration. Like all what they're trying to do through this exam is to make sure that whoever is going to come to the UK are sensible and safe to see their patients. That's all. They are not trying to rank you. They're not trying to like fail you, anything. They are here to help you. They also need doctors, but they're just trying to make sure that we are sensible enough, which we are. We are all practicing doctors. We've been working since, like most of us have been working. We've done med school. So we know how to deal with patients. Just make sure that you're yourself and you deal the situation like a normal day instead of panicking and thinking too much about it. And I know a lot of people are used to, like, I have had friends who take medicines like propranolol just before the exam to calm their nerves down. I mean, it does help. It brings your heart rate down and you feel a little more comfortable. But if it is the first time you're doing something like this, please don't do it. At least try taking it at least a couple of days before and see the effects, and see if you can tolerate. Please don't do it on the day of the exam because it can have adverse effects. I'm not saying this is not good, don't do this or anything, but make sure you know exactly how your body is going to react to it, if you're going to take one of these pills. Personally, I think it's not required. You can just be yourself and take it as it comes. After all, they're just people. You just need to talk to them, that's all. And whatever the medical knowledge, the diagnosis, the things we need here, remember, all of us are people who have cleared Plab-1 already. So our theoretical knowledge has been tested, and we do have the brain strength and the medical knowledge. This is just about communication and how you deal with the patients. This is something you can easily do. So try to avoid taking some pills, but if you think it's required, do try it at least a few days before the exam once, before you actually do it for the exam. So yeah, that's another tip I have for the exam goers. Moving on to the third one, everybody tells you this, carrying one bag station to the next. I hope all of you are aware of how exactly the exam setting is. In the exam, there are going to be 18 rooms in a circuit in which 16 are stations and there are 2 stations. So once you begin the circuit, you go there, they give you some time to settle in, you can have a cup of coffee, the examiner will come and talk to you about how the exam will be, how long it will be, things like that. And then you can go to the washroom as well. After that, you start the exam. So once you start the circuit, you cannot stop in between. Like if you stop in between, it's equivalent to you fail the exam. Like if you decide to quit before you start the exam, GMC might consider and postpone the date and give you another date and give you the fees as well. But then once you start the circuit, there's no going back. Whatever happens in the circuit, you need to go and attend all the 16 stations. So remember this. So imagine your first station, your numbers will be randomly picked and your first station is really bad. If you carry that in your head and keep thinking about it, when you go to the next station, you're going to screw up that station also. You have 8 minutes in a station, you come out in the 1.5 minutes, you're supposed to forget about the previous station, and you need to read the question for the next station and plan for the next station as well. So if you don't do this and you keep thinking about the previous station and carry it with you to the next station, you are really going to screw up the next station as well. And this sucks because all the examiner, the case, the patient, the simulator, everything is new. They have no idea what you did in the last station or why you're disturbed. They're not going to be supportive that way. So if you do that, you're just going to screw up 2 stations instead of 1. Like remember, 8 minutes is all you have. After the 8 minutes, it's done. You don't have to think about it again until you get your results. I mean, hopefully you would have passed, but don't think about it at that point. You need to pass only 10 stations out of 16. So even if you screw up 1, it's fine. You have chance for another 15 stations and you just need to pass 10 in that. So do not worry about that. Please do not carry things that happen in a bad station to the next station. Like there's no point in thinking about it. So please don't do that. Whatever happens in one station, if it's a good station, bad station, whatever it is, it ends there. Do not take it to the next station. That's my third tip for you. The fourth tip is the accents and the phrases. It can be quite difficult for you if this is the first time you are traveling to the UK and you're not very used to the British accent, because they speak kind of fast and they do tend to break words into smaller things. Their accent is quite different. So it might be difficult for you to catch up, but do not worry. You can always ask them to speak slowly and they will be happy to help you. Because like even all of us have an accent. I mean, I do have an Indian accent and it's not wrong to have it. We grew up in that situation and that's why we have it. I mean, just like, I mean, tell them that you need them to talk slowly. You also try to speak as slow as you can and as clear as you can. Just because they're not going to fail you just because you have an accent or just because you cannot understand what they said. That's not the point. They will be happy to help you and take it slow or repeat. Just ask them to repeat. Like imagine they say something and you do not understand. It is always better to stop, tell them, I'm sorry, I did not catch that, and ask them to repeat instead of assuming what they said. Because sometimes it may not be what you think it is. I mean, if they say something and you think it is something else, the whole diagnosis, the whole scenario, the way you respond, everything is going to be different. So do not assume, stop, apologize, and ask them to repeat. That is the best way to go about it. Speak really slow, speak clearly. You don't have to use big words, complicated words, bring in new words. None of that is required. This is not an English exam. I mean, just speak as normally as you can. Talk how you talk to your patients every day. Like, let it be a normal conversation. If you're not used to saying phrases or terms like honey, darling, all these sweet words that the British tend to use, don't try to use it. It just sounds very awkward when you say something that you're not used to saying. You don't have to bring up new phrases just for the sake of the exam. I mean, just be you, talk the way you talk. If you don't understand something, stop, apologize, and ask them to repeat. That's all. It's very simple. They are not here to assess your English. They just want to make sure that you can communicate with them. That's all. So just be very simple. Just be normal. That's the fourth tip. Moving on to the fifth one, it is to, I mean, it's having too much of structure. Like, you need to have a structure. Like, when I say structure, what I meant is when you start, when the patient gives you a symptom, you're supposed to ask the 40 para, you are supposed to ask in detail about that. Then you're supposed to ask about the associated symptoms. You are supposed to rule out the differentials, then go to MAFTOSA, wherein you'll ask about all the relevant past and the family history and lifestyle and things like that. And then you need to move to the examination and then the management. The management also, you need to have a structure, something like where you will talk about investigations, the specific management, senior, specialist, everything. Yes, you need the structure, but then don't take it to a level that it's so structured that you are afraid to move away from that. Imagine it's a counseling station. I mean, in a counseling station, it is better that you ask them a question, deal with it, than you try to carry it on till the management. So if you do it then and there, it will be easier. So in particular to each station, you may have to change your structure and be open to changing the structure. Like, another thing that I have noticed when I take sessions with other students are, you will be like very mechanical. Like, in every station, whatever the name of the patient is, imagine the patient comes and tells you, hi, my name is Amy. You will still go back and ask them, can you confirm your name and date of birth for me? I mean, that is so mechanical. You don't have to do it that way. You can just say, if she says Amy, oh, hi, Amy, can you please tell me your age? That sounds more natural. So go with that. Like, and plus, if they have given both the names, and if the patient is really young, somebody of your age, seeking help, maybe something like a sexual orientation or something like that, feel free and call them by their first name. It should be okay. And if they're really old, always call them by their second name. I mean, it's not necessary that you need to ask them, how may I address you each time and for each station. I mean, what I want to say is, like, it is good to ask. Like, imagine it's a middle-aged patient, somewhere between maybe 35 to 60 years, and you're not sure what exactly you should call them. To them, you can ask, okay, how may I address you? Or how may I call you? You can ask that only for those. But if it's a very old patient who is 85 years old, it's always better to call them with their second name itself, like their surname. It's not very polite to use the first name. So instead of asking that question, I think you can go ahead and just call them Mr. Smith or Mr. Black or whatever it is. And if it's a very young patient, you can just call her by her name, her or him, whatever it is. Just the first name will be okay. That kind of builds up more rapport with the patient, because they are somebody of your age. It will be easier for you to communicate with them if you are calling them by their first name. So use your senses. If it's a middle-aged patient, ask them how they prefer to be called. If it's an older patient, go for the second name. If it's a really young patient, go for the first name, instead of having a constant sentence like, confirm your name and date of birth for me. I mean, I know many academies and places teach you to ask for the date of birth, but then sometimes these simulators, they will not have a date of birth in their mind. What they have will be an age. Remember, these are not real patients. So they are designated a particular age, and it might take them a while to calculate the date of birth. So don't fluster them that way. Just ask for the age. We just need the age. We have to show them that we're going to confirm the identity, and for that, age is more than enough. Then tailor the structure, just like I told you. If it's a counseling station, it will be better if you go section by section instead of following the whole pattern and doing the management at the end. You do not waste time asking irrelevant questions just for the sake of the structure. I don't know how to explain this. Say, imagine it's a case of if it's a child having a fracture. You do need to ask about the birth history to figure out if it was a planned pregnancy and if the child has any serious medical conditions. But then you don't really need to know in detail about that. It's not very relevant to the station. Or maybe imagine some station where you're not going to use things like their smoking history or alcohol history that seriously. Do not waste time on that. If it's not relevant, don't ask. Like whatever you ask, make sure those questions can be reflected in the management. Like if you're going to ask about smoking and if it's a smoker, remember to reflect it back in the management. And this is, reflecting is very important when, especially if the patient is somebody who is going to talk in paragraphs. If they're going to give a big history, and in those times, make sure you listen really well, because otherwise you're going to be like, what happens is like they're telling a big story. Imagine they're talking about how they had tiredness. It started 3 weeks ago, how life has been, how it has been worsening and things like that. And after they tell the whole story, if you go and ask them, okay, do you think the symptoms have been progressing? So that makes no sense. It goes like you haven't listened to them. He just told you about how bad the tiredness has increased in the last 3 weeks and how difficult it is for him to cope up right now. So if you go and ask him if it has been worsening over the time, then he's going to feel like you did not listen at all. So if the patient is somebody who's talking in long sentences, make sure you listen instead of planning the next question. So it's really important to listen and to reflect back. Okay, so that is another thing that I wanted to tell. Moving on to the next one, the scoring system. Remember that there is a structured scoring system that is in place irrespective of what kind of station it is, whether it's a counseling station, whether it is a telephonic station, a history station, anything it is. In all the stations, you are going to be marked in 4 domains. It's going to be data gathering, IPS, and management. So even if it's a normal counseling station where you're going to, or it's a station where you're going to advise the bystander on the 2 people policy station where you're going to advise the bystander on how it's not nice for so many relatives to come to the hospital and things like that. Like it's just going to be a counseling station, but even in that station, 4 marks are going to be for data gathering. That's not going to change. So how much ever well you do your counseling, if you're not going to gather some data, if you're not going to take some data, you're going to be scored out of 8 marks. So your marks are going to decrease. So remember, whatever the station is, remember to ask a few questions where you can collect some significant history related to the station so that they mark you in data gathering as well. Because how much ever well you do this, if you are not going to give them chance to give you marks in each category, you're going to be scored only on the basis of the rest of it. So make sure whichever station it is, you gather some information, you provide a structured management, and you keep communicating in a very friendly manner so that you have marks for IPS as well. So understand the scoring system, make use of it. Otherwise, you're going to lose marks. Like you may think after a counseling station, like I did it so well, I counseled so well, still I have only 8 marks in the station. Now that's because you do not have marks for data gathering. They could mark you only out of 8, and you did kept the whole 8 marks for the IPS and the management, but then you did not collect any history, so you're going to lose those 4 marks. You're going to need all the marks because even if you pass in 10 stations, you still need to have the cutoff. So it is important that you score well in all the stations as well, not just passing. Passing in 10 stations alone is not going to be sufficient. So make sure you do that as well. Yeah, anybody has any doubts so far? Anything you want to ask, or anything, any way you want to, any changes you want in the way I'm saying? Now, I hope everything is clear. We'll go on to the next step. Okay. So my seventh tip for you is making up a management plan. Imagine it's a completely new station. For example, the cat scratch station. It started coming back again recently. Like it's been there only since the last couple of months now. Before that, it wasn't there. And if you're somebody who has taken a course long back, then there are chances that you may not know what exactly is the management for a cat scratch or a cat bite. In that case, do not make up plans. And especially if you're somebody from a different country, you may have a different method in which a cat bite is dealt with in your country, but then it's totally different in UK and you have no idea about how it is. I mean, imagine hypothetically, you do not know what the situation is. In that case, it's always better to say that I am going to go back and talk to my seniors and confirm what exactly I have to do. Or you can always say, I need to refer the hospital guidelines and the protocol to figure out what exactly to do. I understand that this is the condition that's happening to you and these are the complications that can happen. But then regarding the management, I need to discuss this with my team. I need to go back and look into the hospital guidelines. It's always better to say that than to build and than to make up a management plan. Like it's always possible that you can forget things. I mean, you may not remember everything. Imagine it's a patient who had a knee surgery and they're asking, when can I start driving again? You can tell him vaguely, like you can start driving in a few weeks. And once you feel completely okay, and we do a follow-up checkup on you. But instead of that, if you don't remember exactly how many weeks it is and you say a number, if it is wrong, it's going to be a mistake. So instead of stating that mistake, it's better you play vague and tell them that I'm going to go back and check and come. I mean, they can't expect you to remember everything. And it is totally normal to not remember all the details. I mean, what they're trying to see is if you are a safe doctor who cross-checks. I mean, it's better that you be somebody who cross-checks and looks into the protocol and the guidelines, or you talk to your seniors rather than somebody who makes up stuff. So just make sure you don't, like in the exam, in the tension of the exam, in those 8 minutes, you may feel like you have to do something suddenly. But then instead of that, I think it's always better to say that you're going to go back and check how exactly the treatment plan is. That is going to be a much more safer approach to do. So moving on to the next one. The 8th point is showing off too much medical knowledge. I know all of us are in a race to show off that we are really smart and we know all the things and we are really good at diagnosis. But don't play Dr. House in the Plab exam. Nobody cares. Like, they are not trying to figure out if you are the best diagnostician out there or if you are really skilled. I mean, you need to have adequate medical knowledge to keep their patients happy and satisfied. That is what is required. They are not trying to test your medical knowledge expertise here. This is something that everybody should clearly understand. Your knowledge was tested in Plab-1. You need to have sufficient medical knowledge to give your Plab-2 exam really well, but this is not a race to show off all the knowledge you have. Like imagine you want to talk about all the management options for maybe a melanoma. You want to talk about laser therapy, you want to talk about cryo, you want to talk about phototherapy, everything. Okay, you know everything in detail, but if the patient doesn't want to know, you should not try to put in all the information on the patient's head. That's not a good way to do it. I mean, if the patient is not interested in knowing and you keep bombarding them with a lot of information, that's not going to be a good communicative station, and you are going to lose your marks in IPS and in management. That is not the priority here. You need to focus on your clinical skills and communication. You need to make the person whom you're talking to comfortable. Keep asking them, are you interested in knowing more details about this? Do you want to know information on how the management plan will be? Do you want me to explain these things to you? Ask them. Only if they want to know, then you say. Otherwise, do not go ahead and keep on talking and bombarding them with all the information in the world that they have no interest in knowing about. Like, just keep it as simple as you can. Just talk about the basic things. You don't even have to name all the medications. You can just tell them, I'm going to give something to make sure your sickness decreases. I mean, you don't have to name ondansetron and you don't have to name the antiemetics. All you need to do is, I'm going to give you something to stop your vomiting. It's that simple. That's okay. They are not going to reduce your marks just because you missed the name of a medicine. That is not what they're trying to do here. That's my 8th tip. Going on to the next one. 9th one is asking too many permissions. it is important that you signpost when it comes to be some personal and lifestyle related things. It is good to signpost, but then you don't have to ask it multiple times. It'll be too weird. Like, imagine you are going to a doctor, you have taken an appointment, you have waited enough, and you have a condition and you're going to the doctor. So that itself shows that they're consenting to speak to you. They have come out of their free will. They have decided to come and meet you and talk to you about this. So you asking them multiple times in between the conversations, may I ask you some more questions? May I do that? May I do this? I mean, no, you are allowed to do it. If you think these are questions that can be personal or something that they're not comfortable with, you need to signpost. But instead of asking permission, I think it will be better you go ahead and say that I need to ask a few questions about your lifestyle, but just make sure you let me know if you feel uncomfortable at any point or you want somebody else while we do this discussion. That sounds more convincing because you are going to ask that question anyway. I mean, they don't have the choice to say no when you ask them, may I ask you some personal questions? So if you ask like that, they really don't have the choice to say no. They have to say yes. Then what's the whole point in asking for permission? It will be better that you go ahead and tell them that you're going to ask some questions about their lifestyle, and don't categorize it as personal or some different questions like that. I mean, in that way, it feels like you will be just talking about either their sexual history, their sexual orientation, or it might be something about their smoking and their habits. So when you categorize it into something that is very awkward, they can feel like you're putting them in a corner. So don't do that. Just ask them, I'm going to ask a few questions about your lifestyle. So just make it sound like it's not a big deal for you. Even if it's a big deal for you, don't make it sound like it's a big deal for you. It's easier that way. They will like you better. I mean, in Plab-2, it's about how well they like you. So signpost where it is necessary, but not every single time. It's too awkward when you take too many permissions. That was the 9th tip. Moving on to the 10th one, do not assume sexual orientation. I have had friends who had really bad blow up during their exam just because when the simulator said, my partner is quoting me, and he addressed to the simulator that, oh, that's very sweet, I can see that you have a very caring wife. And he got really offended and he was like, no, I'm gay, my partner is a man. So if something like that happens, it's going to be very difficult for you to come back and build the rapport again. So avoid such situations. If they call them partner, either stick to calling them partner itself, or you can go ahead and ask them, what is your sexual orientation? So that way you are in a clear ground. Like, do not assume that the partner will be of the opposite gender. It is not the case. Sometimes they can purposefully, like if you do this, they can also purposefully change their sexual orientation just for the sake of screwing you up. I mean, if they feel like screwing you up, they can screw you up. So don't give them chances to screw you up. So for sexual history, these are the set of questions that you can ask. It's quite easy. I think it should be in this order also. The first question should definitely be, are you sexually active? If it's somebody who's not sexually active, you don't have to go in detail about the sexual history at all. So ask if they're sexually active. If they say yes, then the next question should be their orientation. So that from there on, it is easier for you to communicate with them when it comes to be about their partner and things like that. So what is your sexual orientation? Do you have a stable partner? And after that, ask if they've had any other partners, and then about their safe sex pattern and how they do what this, like if it is relevant, if it's a case of a sexually transmitted disease or anything involving the genitourinary system, you can ask more questions about their preferred route, sex toys, things like that, like the other details also. Otherwise, I think till question 5 will be enough in most of the stations. So that was about it. Moving on to the 11th one, being sorry for everything. I mean, I know most of us understand that the British expects more politeness and more empathy. Yes, it is important to show empathy, but then just don't make it look like you're faking it. I mean, okay, the whole exam is a drama. I understand none of it is true. It's all about faking only. But then try to be as real as possible. I mean, say he says, I have cough since 2 weeks now. I'm so sorry to hear that. I mean, like really, just because he has cough for 2, I mean, a patient comes to your clinic imagine on a regular day, and he's saying that he's been having cough for 2 weeks. Do you really feel sorry about it? No, you don't feel sorry. You will feel like, okay, I need to fix it. So tell that, oh, that must have been troubling. I hope I can help you. Instead of saying that I'm so sorry to hear that. Like, you can say you're sorry when you feel like you're actually sorry. Maybe imagine the patient, it's a BBN station, and you want to tell the patient that he's having cancer. You must be sorry about it. You can say, I'm really sorry, I have bad news for you. So like, if you keep saying sorry multiple times in the same station, the whole value of being apologetic, that itself goes. I mean, they would feel like you're just faking it, because how many times can you be sorry to the same person for the same reason? So don't keep saying you're sorry over and over. Like, use other phrases, tell them you can help you, be supportive, but don't be sorry for everything. Yeah. Moving on to the next one, the 12th tip, bringing seniors in all the time. Yeah, it is important to know that we are a junior doctor. Like, after you clear the Plab, most of you are going to start as a foundation year 2, or maybe as an SHO, as a junior doctor. And it is important that we try and involve our seniors and remain safe wherever possible. But then imagine it's a simple station of maybe say hangover headache or tension headache, something very simple and very basic, and you're really sure about the diagnosis. If you say that I'm going to inform my seniors and get back to you, that just shows that you're incompetent and you cannot deal any situation yourself. So bring in seniors only where you think it is important, or if it's a complicated station, or you think it's something really serious and needs more attention. In such scenarios, bring in your seniors. Otherwise, don't do that. Like, you go blank about one station, you don't know anything to do that. Just saying that I'm going to inform my seniors is not going to help you out. I mean, it's not a backup plan to pull in the seniors when you have nothing else to do. Do not do that. If you do that, it's going to backfire. Like, talk for yourself. If you think it's a serious condition, like if you think that you need help, you need guidance, then you involve the seniors. And if it's a very basic thing and you're sure about the diagnosis, you can say that you're going to discuss this with my seniors, or I'm going to keep my seniors updated and involved in the loop so that you're safe. I will be talking with them, but you don't have to tell that you're going to bring in your seniors, or you're going to inform your seniors for the next step of management. That sounds like you're incompetent, so don't do that. The next one, no medical jargons. This is something we commonly say. I mean, you will be surprised to the things that's spoken here. Most of the people, like back home, most of the people were aware of words like cardiologist or a dermatologist or things like that. But here people call all the doctors as skin specialist, heart specialist, bone specialist. So remember to use simple words. The simulators are not medical experts, especially it's more important in these procedure and examination stations. Like, if it's a abdominal examination station and you go and say, upon inspection, I see so upon palpation, that sounds very wrong. Like, in the mannequin station also, you are expected to talk to the patient and not the examiner. Like, in all the stations, except in some of the Siemens station where they say that you have to discuss with the examiner, you're not supposed to talk to the examiner directly. So you will be talking to the patient itself. So instead of saying upon inspection, you can say that I'm going to take a look at your tummy, and then you can go ahead and say, okay, while looking at your tummy, everything seems normal to me. I cannot see any scars. I cannot see any dilated veins. I can see that the umbilicus is in the center. Everything looks okay, Mr. John or Mr. Black, whatever it is. So it is better that you use simple terms instead of saying palpation. You can say, now I'm going to lightly touch you. And then you can say, I'm going to touch you a little harder just to feel for your organs. So avoid technical terms. Do not make it complicated. They will not understand it. And if they don't understand it, your IPS goes down. So when it comes to a big diagnosis, say, for example, you're going to talk about GCA. So you can say, I think your condition is something we call as giant cell arteritis. That name might seem very new and difficult to you, but don't worry, I can explain it to you. So name the diagnosis, but make sure at the end of the sentence, you explain what it is as well. It's really important that you let them know in simple words what exactly you're talking about. Then when I talk about the medical jargons, I also want to say Do not try to make everything too simple. If they are really commonly used words, stick to that itself. You don't have to call urinary symptoms or kidney as water works. Vagina in an adult, call it vagina. It's okay. You don't have to say front passage. I mean, if it's a child, you can say yes as front passage. If it's an adult, go ahead and call it vagina. I mean, if you want to ask about their bowel habits, ask his bowel habits. If they have urinary symptoms, ask like that. Don't go ahead and ask, how is your wee and poo? For a child, wee and poo is good, but not for an adult. Like if they're simple words, use the simple words. I mean, commonly used words. Otherwise, avoid the medical jargons. Moving on to the 14th tip, this is about teaching stations. I think it's really nice to study teaching stations because you have hardly six or seven teaching stations, I think, and one of that is going to come. So prepare really well. You study 7 stations, you will get 1. That's really a good scoring point. So something you have to understand about teaching station is you need not finish a teaching station. It's not really possible. Like, for example, for my exam, my teaching station was an abdominal examination, and I reached only till palpitation. I mean, sorry, not palpitation, palpation. I could finish only inspection and palpation. By the time I built the rapport, by the time I convinced him and talked to him, when I reached palpation, the bell rang. So I could not finish it, but still I got, I think, 10 or 11 in that station. So it's not about completing the station. Don't be in a hurry in a teaching station. Like, you can begin by telling them that I understand and I really appreciate your interest in knowing about abdominal examination, but I want to let you know that it may not be possible for us to cover all the topics in one session. It's going to be a very vast discussion. I'm just going to tell you about the basics, and if we have to stop in between, I'll always come back and talk to you more if you find this interesting. So say something like that, so that you take a bail even before you start, about how you're not going to complete this. I think that's a safe way to go, and don't hurry and don't try to finish it too soon. That's not the case with an EpiPen teaching station, because if it's an EpiPen, you are expected to teach when you're going to talk to the patient and you're expected to finish the session. I was talking about stations like abdominal examination, dipstick, ECG, things like that. Another trick or another tip that was taught to us was you can say you're going to share knowledge instead of teaching you, because when you say I'm going to teach you this, it feels like you are in a dominant position, and that's not going to be a good rapport. You can say something like, I'll try my best to share my knowledge with you, instead of saying I'm going to teach you. Then always remember, do not ask medical questions. I mean, imagine it's a inguinoscrotal swelling teaching station. You may feel like asking them that, okay, can you tell me what a hernia is? Remember that they are simulators. They will not be able to answer your question. So there's going to be a very awkward pause during the exam. So it's better to avoid that. You can ask questions. You need to ask questions. You can ask questions on simple things like, are you following me? Do you have any doubts? Is there anything else you want me to tell? Do you want me to go slower? Ask such questions so that it feels like it's a two-way communication, but do not ask medical questions. They are not going to answer. They will not know it. My last tip for the day is going blank and stopping in between. Imagine it's a bad station. You have no idea what it is. I know you can panic and stop in between, but please don't. Do not lose your character, whatever it is. Understand that it's just a matter of 8 minutes. And if you go through the 8 minutes and finish it without stopping in between abruptly and saying that you quit, you cannot do this, you're going to get some marks for IPS and data gathering at least. Even if you know nothing, you can maybe get at least some 4 to 5 marks for that station. Even those 5 marks will matter, because I know people who have failed the exam, who have cleared 10 stations and have failed by like 0.5, 1 mark, 2 marks, like that. So every mark that you get is going to matter. How much ever bad a station is, make sure you do not stop in between. They keep going, tell them something, tell something like, I don't know what exactly is happening to you. I'm going to get my seniors. I'm going to do that. I'm going to do this. I'm going to read the hospital guidelines. I'm so sorry I couldn't help you, but I'm sure I will read up more about this. Or say something or the other to make them feel comfortable, so that you get some marks for IPS at least. Because you're going to need all these marks when it comes to the cutoff, because people do fail by losing a few marks. So make sure you do it that way. Just give me a moment. I need to shut the window because there's a lot of sun falling on my face. Okay. Okay. So that's the end of the 15 tips. If anybody has any doubts so far, please feel free to ask me, or you can pop it in the chat, or anything anybody wants to ask, any doubts? Okay, if that's the case, I'll go ahead with the next one. Yeah, so this one is going to be an ethical station, but then from the response that I'm getting from you people, I understand that I will not be getting a volunteer for this. But I definitely need a volunteer. What I had planned was I was thinking of somebody to be a doctor and try the station with me, so that I can give a question and I can give you a feedback so that you will have an idea about how the mock sessions are going to be. So if there is anybody who's interested in trying this out with me, I mean, it's okay even if you're a beginner, if you have no clue of how to do a station, we can do it together. It's just going to be, yeah, okay, I can see somebody is interested. If you can unmute yourself and introduce yourself, it will be better. Okay.
Hi, this is Saili.
Hi, Sally, how are you?
I'm great. How are you?
I'm doing good too. So when do you have your exam?
Oh God, it's on 4th of November.
Oh, that's close. So you must be an expert already. Okay. Good luck for your exam. Let's try this together. Okay.
Okay.
I'll show you the question. I'll put in the timer. Okay. I'm sorry. I have another couple of I have some tips to talk about. I'll get back to you in another couple of minutes. Okay.
Okay, sure.
The ethical station in general, and then we can do the question specifically.
Okay.
Yeah, sure. Thank you. Okay, so before we begin, I just wanted to give a brief idea about the ethical station as well. In general, ethical station, you can divide it into 5. I mean, this is just a division that I did for my ease. You can call one type, it will be BBN, the Breaking Bad News station. There's going to be at least one BBN station. So in total, we have like 9. So if you study these 9 thoroughly, and most of them, it's the same idea basically. So if you prepare these well, you're going to get at least one of those. So that way you can be sure that you're going to pass one station. And it's quite easy because all the information will be given. The whole thing is completely in your hand because you don't have to really think much. You just have to follow the structure and it's going to be easy. Then another kind which we have is the medical error or the colleague related. If it's a medical error station, remember to apologize. Say as many sorries as you can. Do not give an excuse. Give them options on how you're going to improve. If it's a colleague related station, follow SPICE, seek information, patient safety, initiative, escalation, and support. So follow the SPICE, that should be okay. Angry patients, just be calm. You can't help it. They're going to be a lot of drama. Then there's the counseling station. These will include usually lifestyle counseling like smoking cessation. Then there'll be the sexual orientation clinics. Then there'll be people who want to go home, who don't want treatment. You need to convince them, things like that. Then there is, of course, the non-accidental injury, which we'll be discussing today. Non-accidental injury is common to 3 kind of people, usually the young females, domestic violence. Then there'll be the elderly, and then there's the pediatrics. So in ethical stations, the key to a successful ethical station is having patience and listening properly. Like in these stations, like remember I told about not having too much of a structure. In these stations, remember the most important part is letting the patient talk how much ever they can, making them talk and listening to them. You just need to be there, support them, and like just to support them through the whole thing instead of trying to give too much of suggestions. And I mean, it's not about you, it's about them. So remember that. Then you need to collect enough data to reciprocate in the management. This I meant is because imagine it's a bad news about how somebody has a like in medical errors, we have the station where after a cyst removal, the patient comes back with an infection, you give antibiotics and treat them. So most of the times in those, the patient will be diabetic, the patient might be a smoker. So remember to ask these questions in the data gathering so that in the management, when the patient asks you or shouts at you saying that, why did my cyst not heal? Why did this go into an infection? You can always tell them, I'm really sorry, but sometimes this can happen because of your smoking as well. Smoking tends to reduce the healing. I'm really sorry to tell you this, but then sometimes that might be the reason. So remember to have points collected in the data gathering, which you can use in the management to support your point. So that is a really good trick that you should be using. Be supportive, never blame anybody. This comes especially in STDs. Do not blame their partners. Do not agree to them saying that their partners are cheating on them. Don't do that. Never give excuses. Like, imagine you did not label a blood sample. You cannot say I did not label the blood sample because the A&E was too busy. Do not give excuses. Just apologize. That's what this is about. So this is my suggestions for the ethical station. Now we can go ahead and do the station. Sally, so here is the question for you. I will give you 1.5 minutes to read through, and after that we can do the station together. All right?
All right.
Yeah, so your time starts now.
Okay. Enter the room.
Okay. Hi, good morning.
Hi, morning.
This is Siley, one of the doctors working in the pediatric department. Can I just check your name, please?
My name is Irene.
Okay. Hi, Irene. Nice to meet you.
Nice to meet you as well.
So, Irene, can you just tell me how you're related to Mike?
I'm Mike's mother.
Okay. And how old is Mike?
He's 4 months old.
Okay. So how can I help you today?
He had a swelling in his arm, and I brought him into the A&E this morning.
Right.
So I was hoping that you can tell me what exactly is happening and how he's doing.
Okay, sure, of course. So Mike is in the other room. My nurse colleagues are looking after him. We're just making sure that, Mike is all good, comfortable, and happy. Okay. So try
Okay.
not to worry too much about Mike.
Okay.
So, Irene, can you tell me more about what has happened?
I'm actually unclear about what exactly happened. I came
Mhm.
back to work this morning, and I saw that Mike was having the swelling in his right arm. I freaked out and I brought him to the hospital immediately. That's what happened.
Okay, so that's the great thing that you did by coming here in the hospital. So when did you first notice that?
It was right after I came from work and I went to see him, and I noticed it was this morning.
Okay. And who else was there at home who was looking after Mike?
My boyfriend was there. He was taking care of Mike last night.
Okay. So did you try talking to your boyfriend of what happened?
No, actually, he was sleeping, so I did not get a chance to talk to him.
Okay. So you haven't discussed this with your boyfriend, isn't it?
No, I haven't.
Okay. So just wanted to ask you a few questions about Mike's health. So how has been his health recently?
He's okay. He is playful, nice, happy.
Oh, okay. That's great to hear. So did he have any flu-like symptoms recently?
No.
Okay. And how about his wee and poo?
They're fine.
Okay. And does he eat well?
Yeah, he is eating well.
Okay. And was he diagnosed with any medical conditions before?
No.
Any medications that you've been giving him?
No.
Any allergies?
No.
Okay. And any medical illnesses that run in your family? Maybe any bone conditions?
No.
No. Okay, that's great. So, Irene, just wanted to ask you a few questions. Let's go back a little and
Mhm.
wanted to ask you a few questions about his birth. So,
Okay.
was it a normal vaginal delivery?
Yes, it was.
Okay. And did you have any complications during the pregnancy or after the pregnancy?
No.
Okay. And is he up to date with all his jabs?
Yes, he is.
Okay. And any recent jab that he has taken?
No.
Okay. And are you happy with the progress that he's making in his red book?
Yes.
Okay. And you said that you and your boyfriend looks after Mike, isn't it?
Mhm. Yes.
Right. So how are things at home? How is your relationship with your boyfriend, and how's Mike's relationship with your boyfriend?
Yeah, everything is fine. We are happy together. There are no issues at home.
Okay, that's great.
Mhm.
Okay. So so we have done an X-ray of
Okay.
the right arm. So I was just wondering if anyone has spoken to you about this.
No, actually, nobody has told me anything yet.
Okay, okay. So the thing is, Irene, we have done the X-ray, and the X-ray shows that there was a spiral fracture in the right arm.
Okay.
Yes, and the things that you have told me, actually it's a little bit concerning, because the type of fracture that Mike has got is very unusual at this age.
Okay.
So basically, this fracture happens when external force is applied. And by that, I mean when somebody grabs the hand forcefully and twists it.
Oh, God, that's scary.
Right. I know it's very scary, but that is what the X-ray is showing, Irene.
But how is that possible? It's just me and John who takes care of Mike. I mean, I don't understand what you're saying.
Right. So what I'm trying to say here is, Irene, the type of fracture that Mike has got is very unusual at this moment, at this age, because, young children, their bones are very, uh, they don't tend to break easily, isn't it?
Okay. Okay.
Right. And what has happened to Mike is something concerning.
Doctor, are you trying to say that we did this to Mike?
No, Irene, no, I'm not trying to blame anyone. I'm not trying to say that you have done this to your child. No, not at all. But, it is one of the possibilities that somebody has done it, because it happens only after twisting the arm.
Oh,
I
God.
hope you're understanding what I'm trying to say.
Yeah, I understand. That's a very scary thought. Yeah, I need to talk to my boyfriend about this. But I thought they were both okay. There were no issues at home. Yeah.
Right. Okay, so Irene, that's really great if you could talk to your boyfriend regarding this.
Mhm. So
Right.
what are you gonna do now?
So what we're going to do is we're going to run some investigations to make
Mhm.
sure that everything is okay from medical side. So we
Okay.
might have to do some scans.
Mhm.
And also I'll definitely involve my seniors, and, I'll ask my seniors to review Mike.
Okay.
Right. And for that reason, we'll have to keep Mike here in the hospital for a while. Is that okay for you?
Yeah, that sounds okay.
Okay, right. And also, what has happened now, Irene, is something that I cannot let go. And that is why I'll have to involve social services in this.
Social services, really? I've heard all these nightmare stories about social services. They're going to take Mike away from me. I did not even do anything here. I don't want to lose my son.
No, not at all, Irene. No, they're not going to take Mike away from you. Actually, their number one aim is to keep children with their mom. They just want to make sure that the environment they're staying in is safe for the child. That's all they want to make sure, nothing else.
Okay. Okay. Well,
Right.
it's scary. I hope it goes in good sense. Yeah.
I know you're scared and you were not hoping to hear all this today.
Mhm.
I know that, but when the social services will come in, they'll definitely help you in this. They'll
Okay.
just make
Okay.
sure that you and your child are safe.
Okay. Fine.
So, how does that sound so far, Irene?
That sounds good to me. Yeah.
Okay, and do you have any questions?
No.
Okay, so right now we are giving some painkillers to
Mm-hmm.
Mike. We are
Mm-hmm.
making sure that he's all good and comfortable.
Okay. Thanks.
Okay. Okay. So, Irene, if there's anything, if you want to ask any questions, please do not hesitate to contact me. I'll be just here around.
Right. Thank you.
Okay. Thanks a lot.
Okay, good work, Sally. First of all, I appreciate you for the timing. You finished exactly on the dot. Like finished when there's like 1 second left. I mean, I should really appreciate you for that. You did miss a few things, which I'll be explaining to you.
Okay.
This is, I mean, I just want to let you know, this is how I usually take my sessions. So I give the question, we do the session together, and then I will be making a slide for details on each thing so that we can discuss in detail. I really want to tell you that I'm not an expert in this. I'm just somebody who's given the exam and I know what they taught us. So this will be more like an interactive session where we can discuss and improve how you can present the case better. So, but then since I refer the notes and make the slides, I'll be able to point out the smallest details also that you missed. So please don't get demotivated. I am a bad at most of the time. So I just want to tell this in advance. But then you did a really good job. I think your IPS was really strong. You were very sweet, very concentrate. The rapport you built was good. You covered most of the things. You had a good structure. You went really well about the whole thing. I mean, I really liked how you spoke. You kept talking about how Mike is comfortable. I think that's really a very good approach. And you take or get the mother's confidence by saying Mike is good, my colleagues are looking after him, you're going to give painkillers, you're going to make him comfortable. That whole part was really lovely. Like, kudos for that. But now going to the details that I think you missed. Details before bringing to the child to the hospital, you did that well. You asked how exactly it happened. You congratulated her for bringing him immediately. Really good work there. But then one important thing that you missed is the caretakers of the child. You need to specifically ask if there is anybody else, like other than the boyfriend and she herself taking care of the child. Because if there is a babysitter, if there is any other children at home, it is possible that it can be somebody else also. Because remember, at the end, she was asking, do you think my boyfriend did this to me? You cannot really be sure because you don't know if there is somebody else who's involved in the child care. So in the data gathering, it is an important question to ask, is there anybody else who takes care of Mike, like a babysitter? Or so is there someone else who's involved in the child care? So you need to ask that question, especially if there are other children there. If there's an elder child, it can be a possibility that can be a fight between them. So remember to ask if there is anybody else at home who is taking care of the child or anybody else is living in the home. So basically that. The next thing that you missed out was you did not ask if her boyfriend is the biological father. I mean, I'm not saying that the biological father, once it falls under the umbrella of the biological father, the child is safe with the father. But most of the times, if it's a stepfather, the chances of NAI might be more than if it's the biological father. Also, when you ask about the birth, I think it's important you ask if it was a planned pregnancy, because if it's a planned pregnancy and he's the biological father, it shows that basically the parents care a lot and the child is really precious to them. So then we need to think about somebody else who's doing this to the child. So I think it's important to ask if it was a planned pregnancy and the biological father. The relationship between them, you did ask, good. You asked whether you confronted him and what he said, that you asked, good. You need to ask this also, if there's anybody at home who uses any drugs or alcohol, because it's possible that the father might be actually lovely and takes care of the child really well, but then he might be under the influence of some drugs or something. So you never know. So I think it would be nice to ask that also. But I think the fifth point is like an extra point. It's okay. I mean, when I ask, I think I might forget this one, but the biological father and planned pregnancy is definitely an important questions. And if there's anybody else taking care of the child, those are important things. And I think you should not miss those out in the data gathering. Those were the few things that you missed. And then you need to ask if this is the first time that this has happened to the child. I know we all follow the bird mnemonic when it comes to pediatrics, but then a trick to follow is always stick to F bird, so that the F stands for first time. Because if this has happened before also, if it's happening too frequently, it means either that the child has a bone condition where his bones are breaking too fast, or it means that there is some serious NAI happening and the child is suffering again and again. So it is important to ask if it is the first time that this is happening. Okay, that's about the data gathering. Moving on to the management, you explained the spiral fracture really well. It was really nice the way you talked about how it's twisted and it's unusual, all perfectly good. You did talk about admitting and orthopedics referral also you said. This is one point which is specifically done in cases of all NAIs. You have to tell them that they'll be taking further x-rays and scans of other parts of the bone, other parts of the body as well. This is done to know if there have been any old fractures or any other old injuries. So I think this is one specific management particular to the NAI station. So if you can remember that, it will be good. You have to say we'll be taking more x-rays of other parts of his body to make sure that this hasn't happened before and there are no old healing fractures. So remember to say that. Social service, the way you said was really nice. You did that really well. Safety netting as such, there isn't much to safety net in the station. So I think it's okay. Even if you miss out, it's okay. But in general, in all the stations, remember to keep at least 30 seconds, save 30 seconds to safety net. Because like I told you in the whole presentation, they're trying to see if you're a safe doctor. So safety netting is really important. Whatever the case might be, make sure you spend 30 seconds to safety net or ask for a follow-up. That's very important. But I think in this station, it's okay if you don't, because the child is already in the hospital. He's being attended by your colleague, so it's okay. In the IPS, appreciate mother for bringing child immediately. That's really nice. You can ask if the mother is working, because there is a chance that the mother might be working and she might be having personal stressors, which might be the reason why she is angry with the child and possibility of an NAI. But if she's a working mother and you feel like the mother is really caring, you can appreciate her for balancing the whole work and life balance and things like that. But it's nice. You appreciated the mother, which was really good. Do not blame the boyfriend, just tell that it's to safeguard the child. You did that well. Social service, you can always say they will not be taking away your child. They're just here to ask you questions and to make sure everything is safe for you and your child. I think that you did it well. Yeah, this is one line I usually use in these settings, because if they are too furious and they're not agreeing to the whole social service scenario, you can always use the tagline where you say, whatever the social service is doing, it is for Mike's goodwill and safe health. Isn't that what you also want? Like, aren't we both on the same page here? We're just trying to keep Mike safe. Is that right? So even if she is somebody who's done the NAI, she cannot say anything. Like, we are talking about the safety, so it's like you put them in a block, in the lock. So that is one line that I used to use in such stations, and it worked for me. I had the station for my exam as well. So yeah, that's about it. But I think you will pass the station. Definitely. You covered most of all the important things. You did miss out few things here and there, but I think that's okay. You will be fine. Maybe I'm reading and you should be okay.
Okay, thanks a lot.
Yeah, it was lovely speaking to you. Thank you for. I was really worried if I'll get a volunteer to the station, and I'm really glad you accepted that. Yeah, thank you.
Thank you.
Yeah. Moving on to the next part. I know I've been talking only about what you should avoid. I have a little bit of tips on what you can do to improve yourself on the exam, how to prepare, and in general, just few things that I think will be helpful. Remember to focus on the recent stations more than the others. Like you will find documents which talk about the recurrent scenarios that come in the exam more than the whole bundle. Like if you look at the whole bundle, we have around 350 plus stations in total to read. So that's not really practical. You may be able to read it once, but then when you revise and you prepare well and you practice, make sure you go through, there are only like 150 to 200 stations that keep coming repeatedly. So focus on those stations more. That will help you really well. And you need to be thorough with the Siemens and the procedure station. I cannot say this enough, because a Siemens station, the whole thing is with you. The whole control is in your hand. If you prepare that station really well, you can definitely pass in that. And another thing is there are only 10 Siemens stations. So if you prepare those 10 stations really well, you have one station short that you're going to pass. That's the same thing with the procedure stations also. There are hardly like 10 to 12 procedures. So if you learn them really well, you already have 2 stations, 2 or 3, maybe sometimes there'll be 2 procedure stations also. So out of the 10 that you need to pass in, you already have 3. You need to worry only about 7 more. So make sure you study these stations really well. Yeah. then practice and try to have a stable partner. This is important because I mean it's nice to practice with random people as well, as many people as you want. It's a good thing, but then the problem that's going to come, I mean, or the advantage of having a stable partner is they kind of have a commitment to you, so they will be more critical. They'll tell you corrections better, so they will act like a support system for yourself. I mean, I am really glad for the partners I had while I prepared. So I think it will be nice if you can find one stable partner at least. Aims in management is a mnemonic that we used to use. A is for admit, refer, or discharge. I is for investigations. Management is for the specific management. One S is for seniors or specialists, and the other S is for the safety netting. So if you try to stick to this pattern, you will have a structure for your management and you won't miss things out. You will be organized, and it makes sense that way. You won't forget the safety netting also. You don't forget the specialist also. So try to use this mnemonic for management. Making flashcards or slides with highlights will be really useful, just like the one that I made for NAI, so that when you see that thing, you remember these are the things that's particular for the station. So it will be easier for you to revise. Be familiar with the exam venue. This is crazy. I know this sounds silly, but there are two venues. There's one called the Hardman Square and there's the Hardman Street. Make sure you go and check which one is yours and get used to the building. I mean, like look into images in Google, find the exact address. Don't get confused. They're two different places. Another thing is, if you're in the street, you will have more telephonic stations and video consultation stations more than in-person simulators, whereas in Square, you will have in-person simulators. So while you prepare, also you can plan depending upon which is your exam center. Reach before time, eat and drink really well before the exam, because this again, I want to stress on this because it's going to be a continuous circuit. So once you begin, you really do not have a stop except for the restrooms. So just be ready. Do not be in a hurry. Be calm. Don't try to read too much on the day of the exam. Just be yourself. After all, it's just a communication exam, so it should be okay. Utilize the restrooms here, the rest stations in the circuit. I mean, I know you will be panicked, you will be nervous, you will be worrying about the previous stations, but they give really good yummy cookies. Eat the cookies, have the coffee, go to the restroom if you want. Utilize the rest stations really well. Try to dress it professionally. Wear formal shoes. I mean, they are not very particular about what you wear. The only thing that they say is the toes must be covered for everybody. That's the only particular thing that they say, and that the sleeve should not be below the elbow and no rings and things like that. But then if you wear something really professional, I think you will have some confidence by that itself, and it will be nice for you for the exam because you will feel like a doctor. So dress up in a way that gives you some confidence and something that's very comfortable. Don't wear fancy shoes because you have to walk and stand and run in the circuit. So yeah, wear something really comfortable. After all, the last thing is smile, greet, and talk confidently. Like I told you, how much ever bad the station is, make sure you get the 4 marks for IPS at least. Talk to them, smile really nicely, talk confidently. How much ever you don't know, just go ahead and talk. Then it should be fine. So these are my tips for the exam, things you can do. Anybody has any questions or anything you want to ask, I'm happy to tell that now. You can put it in the chat also if you're not comfortable to ask. Any doubts, anybody? Okay, I think that's it. So yeah, that was about everything. So what I mean, my simple tip or suggestion to all of you is just be yourself. As long as you're normal and yourself, it should be really okay. Yeah, could you repeat the exam places? There are 2 centers. One is the street and another one is the square. It is totally randomly given when you book the place. You don't have a control over it. But then the mail you receive from GMC, it will be mentioned which one yours is. So take a look into it. If it is the street, you tend to have more telephonic and video consultation stations more than in-person clinic setup. And I think the walking distance, it's more than 1.5 minutes because the stations are a little far. So it's a bigger circuit. They'll give you more time for that also. So that is about street. If it is square, I had my exam in the square. In the square, most of the stations will be simulator. I had just I think 1 or 2 telephonic stations and 1 video consultation. The rest all it was live simulator. And important stations, the Siemens, I think you have to really focus on the Siemens, because that's going to give you one station. Then there's the procedure station, that's also going to give you 1 or 2. Study the teaching station really well, because there's just 6, one of that is going to come. Again, focus on the teaching station. Then yeah, BBN, at least one BBN is going to come. Counseling station, it'll be, but the rest of it, it's going to be a balance. But remember to study these, that's definitely going to come, and there are very few options for that. So I think it's clear with you. Will this recording be available? I think it will be. I think, yeah, Mafia will explain. Somebody from MedExpert will help you with that. I think it will be available. Yeah, prescription station too, important. Prescription stations are easy but tricky, and this is another station which is completely in your control, like fully in your control. There won't be an examiner in the room. There will not be anybody else questioning you or anything at all. So prepare the prescription stations also really well. When it comes to prescription stations, I want you to tell, like when you read it, it might feel like it's very easy, but then time it and try to write it out. But because most of the times you end up not having time to finish your prescription station, so make sure you try practicing and writing. Like when you practice, you feel like it's just about writing few things, like copying from there. Why can't I do it in 8 minutes? That's not the case. You will run out of time. So make sure you write and practice the prescription stations really well. Yeah, so no, my mocks are not free. I was just going to talk about that. So you can either do a mock session. These are the available things that you can do. There are practice or mock sessions that you can do. It will be 1-to-1. It will be just 2 of us. And you can either take up mocks, wherein I'll be discussing up to 15 or 16 stations, whichever happens. I mean, it'll be around for 4 to 5 hours. How many ever stations we can do in that time, we will be doing that. And I'll give you a personalized feedback just the way we did. And I'll be sharing the slides and the details with you as well. And after the session, I'll send you the slides, and I'll also send you a detailed marks card on how much I think you will get for that performance. I mean, that station, what you did. And yeah, you can choose it. You can sign up now and choose a time slot that you want. Per mock, I'll be doing, each mock will be for 4 to 5 hours. I think we'll be able to do, I mean, I speak in detail about each station, so it kind of takes time, but I think we can go for maybe 15 stations, or yeah, around 14, 15 stations. I mean, somewhat around that. It will be for around 4 to 5 hours. I mean, we can plan it accordingly. Yeah, that's about the mock. If you are looking for a regular study partner, you can do that also. We can fix at 5 stations a day. If your exams are far away and you want to regularly practice, we can do something like daily sessions, 5 stations, instead of taking a whole mock together. You can try for that also, but then that I'll be taking only very limited students. Yeah, if you're interested in that, please contact the team, or you can message here. So yeah, you can contact in one of the, in the chat, the team is putting up details on where you need to contact for any of these. So you can just get in touch with them and let me know, or let them know if you are interested in doing mock sessions with me. So this is exactly how it is going to be. We'll be doing a station, you'll be discussing it, and I'll be giving you feedback and details about what that is and how to approach that station. So yeah, that's what this is about. And yeah, so again, once again, there are 2 kinds. You can either do a mock or you can do regular sessions, whichever you think works better for you. If your exams are nearby and you are really prepared, I think go for the mock sessions, so you will get an idea of how random stations together you can fare well in that. If you're somebody who just started practice and you want regular sessions to slowly grow in that, you can go for the regular study sessions. Whichever works for you, you can do that. Yeah, that's about it. Thank you. So that's the end of the session. I hope all of you enjoyed it. If there's anything else you want to know or ask, we also have a WhatsApp group. You can join in the group, and you can ask your doubts there. I'll be happy to tell it there. Or if there's anything else now, you can pop it in the chat and I'll reply. So yeah, I hope everybody had a good time. It was informative. And I'm sorry, it got a little longer than what we planned. I mean, yeah, I always run out of time doing sessions. So yeah, that's about it. Anything anybody wants to know, or otherwise we can end the session. Okay, I think that's it. Thank you. Thank you, everybody.